So when we started to look at group medical visits and then we were looking at access and other issues, we said, okay, this could be an innovative way to address them. However, because it is across the system, we want to figure out how can we then help these quality improvement initiatives be surrounded by research? Because learning health system is also about how experience can inform evidence. So right now in the year that we have done the group medical visits work, so we've had 3 teams that have gone through the process. One is a primary care team, and it was a nurse practitioner-led team. Another is an integrated chronic disease and wellness model, and in their team they've tried to address continuity of care, access for priority chronic conditions, and the other is a service for patients with multiple chronic conditions.
They look at their own team, their own patient population, their own community, look at what their needs were, design the group medical visit around that, and then they would continually adapt and evolve the program based on that team. So it was done with intent to have it rolled out across multiple teams, and each team took that quality lens to make sure it made sense and worked for the people that they were working with.
From our clinicians, we kept hearing they were saying they were doing the same education over and over, or they didn't have enough time to do the education and support to help teach people how to live really well and get an optimal health and well-being during a regular patient visit. The group medical visits was providing a really neat option to provide care.
The physician that was here retired, and therefore there was nobody coming to this area. So we had to be quite creative because I have a full practice of approximately 1,000 patients. So it wasn't really feasible for me to take on new patients. So we tried to figure out a way that we could take on a larger group of patients, still see them and provide them with some kind of care.
I didn't have a doctor. The first time I just come to see Terry Lee for pills, and then I started going to the staying for the talk and everything.
It's not all groups. So you start, your first initial appointment is with myself for a half hour. After that, I see them every time, each one-on-one for however long it takes, and they do get that visit on top of the group medical visit. I'm gonna be honest, I was probably one of the biggest critics for this when it first came on, because I was like, we're not really doing anything, we're just kind of plugging holes. But then the more I've been a part of it, the more I realize, no, we are. Is it giving them perfect care? No. Is it giving them something? Yes. So it's keeping people out of the ER for the refills, which is huge for a lot of people. It's giving them education and hopefully tools. I think we need to approach things differently in many ways, and people need to be given the tools to be able to help themselves.
You know, I'm not good at any of that. I don't walk or exercise. But to hear them talk, it makes sense. I should be doing it, you know.
They don't try to get something out of you. If you've got a worry or question or whatever, you can discuss it.
It just helps you learn more about your health and your diet and it does help.
Is it the same as having a family physician or a nurse practitioner? No, because they can't come in to see me for everything. But it is filling a hole that otherwise is here.
I'm looked after medically and everything is good, and it puts me at ease to know all this stuff. So it makes a difference. Everything you do makes a difference.
Primary health care is that learning health system. We have demonstrated that through the group medical visits initiative. We are demonstrating that people are happier because they're getting access to their healthcare provider, and more because you have the group experience and you have more providers in one visit helping you get better. And it is because we are really being innovative. We are taking evidence that has been established but also creating new evidence. So that means you have a health system that is willing to learn and understand, working both ways through evidence and through experience. So I think that's something to be excited about for Nova Scotians.